or notice, we will know that is a warning sign that the individual is having kidney disease. Well, I will begin by defining the kidney, what kidneys are. We know that we have a pair of kidneys. Kidneys are retroperitoneal organs. This means that they are located behind the peritoneum of the posterior abdominal wall. And kidney has several functions. The primary function of the kidneys is to reabsorb or remove waste products of body's metabolism and toxic substances from the body. It aids in the reabsorption of water and minerals, and also maintains fluid and electrolyte balance. Other functions will include regulation of blood pressure through hormonal mechanism, that is renin-angiotensin mechanism, the hormone that aids in the secretion of antidiuretic hormone, the hormone that helps in reabsorption of water in the body. There's also the function of helping in reabsorption of vitamins such as vitamin D. Vitamin D is very essential in bone formation. For instance, it aids in the reabsorption of calcium, a mineral called calcium, and magnesium. Calcium is required in the formation of bones, and by this, through the action of vitamin D, calcium is being synthesized, and this aids in strong bone formation. There's also the function of red cell synthesis, red blood cell, synthesis of red blood cell. Because kidney produces several hormones. Renin-angiotensin is not the only hormone produced by the kidney. Kidney also produces erythropoietin. Erythropoietin is very essential in erythropoiesis, that is production of red blood cell and other cell components such as platelets and white blood cells. So erythropoietin is produced by the kidneys, which are essential in the synthesis of red blood cell. Now, how do we develop kidney disease? Kidney disease can occur whenever a kidney fails in its primary function. The primary function of the kidney, like I mentioned earlier, is to aid in the removal of waste products of body's metabolism and excretion of toxic substances from the body. So any attempt or anything that affects the kidney in a way that the kidney can no longer do this primary function and the other functions that I mentioned will result in kidney disease. There are various types of kidney diseases, and each of these diseases affects the kidney according to its several parts, because kidney has different parts. It has the glomerulus, then it has the tubular section or aspect. So whenever you have glomerular diseases, it means that the disease affects the glomerulus. For instance, we have acute glomerulonephritis. We have chronic glomerulonephritis. We also have glomerulosclerosis. All these diseases are the diseases that affect the glomerulus, where the urine is filtered. Also, you have other diseases of the kidney, such as a disease that affects the tubules. You can have acute tubular necrosis. You can also have drug-induced tubular necrosis. For instance, most people that abuse aminoglycosides, such as gentamicin, which can, over a time, damage the kidney. There's also another form of illness in the kidney, which they call polycystic kidney disease. This is when you have multiple cysts in the kidney. It can affect one kidney, it can also affect both kidneys. There's also diseases of the kidney which are derived from urinary tract infection. So people can have develop ascending infection along the urinary tract from the bladder through the urethra. Sorry, from the urethra through the bladder to the ureter, and this can get to the kidneys, to the renal pelvis, and the person might end up developing pyelonephritis, which can be acute or chronic. We could also have stones, what they call nephrolithiasis, stones in the kidney. People can develop stones in the kidney, and this is referred as nephrolithiasis, calculi. So all these are kidney disease. There are many other kidney diseases, but I just want to, we are going into recognizing and preventing kidney diseases. Now, how do you recognize, before we get to recognizing kidney disease, we have to talk on the risk factors or the causes of kidney diseases. We know that in medically, the major cause of kidney disease in our environment nowadays is diabetes and hypertension. That people, more people, even younger people now get diabetes and hypertension. We have type 1 and type 2 diabetes. So these two major causes of kidney diseases, it now means that the risk factors to these two major causes of kidney diseases invariably will be the cause of kidney disease. The risk factors of hypertension and diabetes will invariably be the risk factor or indirect cause of kidney diseases. And such risk factors will include cardiovascular diseases, smoking, alcohol abuse, excessive alcohol intake, which is seen in chronic alcoholics, have things like inactivity, that is lack of physical activity, lack of exercise. We have unhealthy diets, unnecessary or inappropriate weight gain, people gaining weight unnecessarily. We have excessive tobacco use. We have a family history of hypertension. We have family history of kidney diseases. People that develop hypertension, that whose family lineage are prone to hypertension. But nowadays, people can develop that regardless of having it in their families because of their lifestyle. We also have history of ectopic kidneys, kidney being in the wrong place. When the position of the kidney is not where it's supposed to be. Like I said, kidneys are retroperitoneal organs. They are supposed to be behind the peritoneum of the posterior abdominal wall, and the right kidney is slightly lower than the left kidney because of the liver, the bulk of the liver, the impact of the liver. So, but sometimes you may see these kidneys find themselves in other parts of the body. For instance, you may see a kidney that's supposed to be on this place that I say, the retroperitoneum. The kidney may become in the pelvic region, or it may be in another part of the abdomen. And these things may, one way or the other, predispose the individual to kidney disease or kidney problem. Also, you have indiscriminate or people who use drugs, who abuse drugs. You and I know that drugs has side effects. So most drugs have adverse effects. So some drugs may impact negatively in your kidneys. For instance, when you choose to self-medicate instead of having a health practitioner prescribed for you, you choose to give yourself drugs such as aminoglycosides like gentamicin and all the rest of them that has streptomycin, some of the drugs that are actually have some effects, side effects on the kidney. You may take overdose and this thing might result to acute kidney injury. And also on the part of, there's also a risk of diabetes, people who develop diabetes as a result of you know overweight. For instance, in type 2 diabetes, people can develop this people can eventually come down with kidney disease, especially when they don't take their medications or when they don't see their physician. They might end up becoming people with kidney disease due to diabetic nephropathy. So people, again, is also seen in people who have what is called gestational diabetes. Gestational diabetes is a diabetes that you acquire during pregnancy. If it is not properly or well managed, it can progress to what? To diabetes. Person may finally become diabetic, and this may end up, if you are not too careful, it may still end up to you having a kidney disease over in future. Now, how do we recognize these kidney diseases? Kidney diseases can be recognized. There are some certain symptoms which an individual can experience, and when you start experiencing such symptoms, it is a warning sign that you are having a or trying to develop kidney disease. So you need to do something about it before it is too late. For instance, if somebody is having fatigue, muscle weakness, fatigue, and the person is becoming excessively tired, all the time you are tired, you don't know what is causing the tiredness. That is why we need a medical checkup from time to time. So it might be a sign that your kidney is being affected one way or the other. Also, when you have generalized body itching might also be a warning sign that you are having some kidney issues. Again, when you have complaint of frequent urination, excessive micturition, it is also a sign that should draw your attention, that you should take very serious to know why you are urinating frequently, especially when you don't take water for a longer period, and you notice such, or you notice that whenever you drink, after some time you just feel like you are urinating too frequently. Also, when you have things like foamy urine, your urine is usually foamy, as if is foam. After micturating, you notice that the urine is foamy. It could be also a warning sign or symptom that you are having some challenge, or that something is about to happen. Again, when you have things like oliguria is decreased urinary output. When your urine output is reduced, it could also be a sign that your kidney, you are not hydrating your kidney well. That is, you are not taking adequate water. You are not challenging your kidney. Or it could be that you are trying to develop kidney shutdown. Maybe that your kidney is not functioning well. So it is something that you should take serious. Don't just overlook that. Again, it's when you have puffiness or swelling of the face, or periorbital swelling, what they call periorbital swelling. That is when you have swelling around your eyes, around your socket. It could be a sign that you are developing kidney disease. Again, bilateral leg swelling is also something you should worry about. Bilateral leg swelling means that when both legs, you notice that your legs will start just when you wake up one morning, you just notice that your legs are swelling gradually. It should also be a thing of concern. The leg swelling could be as a result of kidney issues. It may be that your kidney is deteriorating in function. So it is also a thing of concern. You should not overlook. Again, is when you have things like confusion, lack of concentration. From time to time you don concentrate, you lack, you are confused, you feel to vomit, you have nausea, or you notice that when you urinate you are seeing blood in your urine. That is called hematuria. Hematuria could also be a sign of kidney issue. So you need to take it very seriously. You need to come to the hospital, see your doctor, or try to know, inquire more what is going on in your body. Now, having said this, we will now move over to prevention of kidney diseases. Having known all these risk factors, that they are interwoven, they are, all of them are interwoven, they are like this, the one is not, when knowing one can lead to the other. So it now means that we should, if we can be able to avoid all those risk factors, then invariably we should be able to prevent kidney disease. If we can avoid the risk factors of kidney disease, then we should be able to prevent it, because when they say prevention is better than cure. So what I advise is that, how do you prevent kidney disease? I advise to avoid the risk factors of kidney disease, which I have elaborated. Then we can be sure that we are far from having kidney disease. For instance, you also need to do something on your diet. You need good choice of food. Like for individuals that take unhealthy diet, that is not good to us. So we should always take balanced diet. Try and take balanced diet, no matter how it is, how small it is. We should make it a priority that we check our diets, so that we don't take such diets that are injurious to our health. Like when you consume high salt diet, I didn't remember it in the risk factor. It's very important. High salt diet is something worrisome, something that can over a time affect your body, your blood vessels, and predispose one to hypertension or kidney issues. So we should avoid high salt diet. We should take lots of fruits and vegetables, make it part and parcel of our diet, our food, to avoid this kidney issues. Then I think we should also do more on low, we should not be taking more fried meals, things that we can be predisposed to high cholesterol, hypercholesterolemia. That is, things that can make our cholesterol, low density lipoprotein cholesterol, to always increase, and the triglyceride to always increase. So we should avoid all foods that are rich in unsaturated fatty acids. Foods that are rich in saturated fatty acids. We should always avoid high fried diets. We should boil our meals. That is more healthy than taking lots of fried meals. Also, we should engage ourselves in regular physical activities, such as routine exercise. We should do exercise regularly. That will help us a lot. For those that are obese, that are overweight, it will help them to reduce their weight to proper size. And for those that are not obese, it becomes a fitness, a thing of medical fitness. It makes them fit all the time. So they are now doing it regular physical activity to keep their body fit, and that is good for our health. Again, we should also have adequate sleep. Whenever we are out from our work duty post, and when we come back to do our normal chores in the house, we should always make time to sleep. If you find yourself in the afternoon period, you should have some rest in your house whenever you feel sleepy, don't postpone the sleep. Just give yourself rest. And in the night, I advise that we should always aim at sleeping for 6 to 8 hours. Have adequate sleep, because they say that sleep releases good hormones that are good for your health. Like, there's a hormone they call the melatonin. Melatonin is good for your health. When you sleep with light off, there's a generalization or production of melatonin, which improves your immune system and also helps your body to function in normal way. And all these things will contribute to promoting good health and avoiding kidney problems. We also advise, especially this is on the youths and other people too, everybody, to avoid taking high alcohol. To avoid, in fact, if you can avoid alcohol, is good, but if you can't avoid it completely, reduce the intake of alcohol, because alcohol intake can affect your liver. And if it affects your liver, that invariably can also affect the kidney. There's what they call hepatorenal syndrome. Hepatorenal syndrome is whereby a condition whereby disease of the liver will now progress to the disease of the kidney, will affect the kidney. So we should avoid excessive intake of, or avoid it completely, or reduce the intake of alcohol. We also need to avoid smoking. Those that smoke, know that when you are smoking, you also endangering or predisposing yourself to hypertension and other conditions. You can also predispose yourself to lung diseases. All these, especially when you predispose yourself to hypertension, can affect your kidneys, because it is research has proven that cigarette smokes, for instance, has what is called nicotine, and nicotine cause vasoconstriction, can constrict your blood vessels. And when your blood vessels are constricted, this will lead to increase in peripheral resistance. And if you continue that way, it will invariably lead to kidney disease, because you may find yourself developing hypertension even when you don't have the family history of hypertension. Also, I advise also that people should try and, as much as possible, to manage stress or reduce stress, because stress is not good to our body too. When you have stress repeatedly, because stress releases what is called cortisol. Cortisol is a stress hormone, and the stress hormone can trigger gluconeogenesis, oftentimes making your blood glucose level to rise, and this is not also good always to the body, which may invariably, over a time, person may start gaining weight, and if not controlled, it becomes a risk to diabetes. Again, um for those that have already come down, and this is the final note, for those that have already developed diabetes, hypertension, and heart diseases, I suggest they should um seek medical treatment, so that they can be properly managed, and this will help to prevent them from becoming, or having kidney disease, because I mentioned that diabetes, hypertension, and cardiovascular disease are the major causes of um kidney disease. So since they have already come down with diabetes, they are diabetic, or they have developed hypertension, they are hypertensive. So it suffices to say that they should seek experts in order to take care of their diabetes, control their blood sugar, control their blood pressure, and then sort out their heart disease, whichever one they have come down with, and invariably they will be okay. They won't have complication, because the complication of not addressing diabetes, hypertension, or heart disorder will eventually lead to having a kidney disease. On this note, I come to the end of this presentation. Thank you very much.
Thank you so much for that wonderful presentation, Dr. Collins Okoroafor. We believe we have all been able to gain one thing or the other from this session, and we hope that as many of us that have one or the other will be for the doctor. Okay, there's a question from Mr. Abdul Semiu Adekunle. Just like in the chain, I was discussing with a friend yesterday, and he told me that his brother developed kidney disorder due some prescription. Please kindly explain. I think that question is not clear, Mr. Abdul. That question is not clear. Okay, I don't know if Dr. Collins understands the question. So, but if you do not, if you can unmute yourself and explain succinctly. Mr. Abdul, you can unmute yourself and ask the question so Dr. Collins can get it.
Hello, good afternoon, everyone.
Good afternoon.
My question that was this time to time and error. And he told me that his brother developed kidney problem due to some prescription that was given to him. And in the process, it developed such that dialysis was not to the point of kidney transplant. Up till now, can you explain some drugs that could lead to that, or can there be error, or can there be normal thing? So if there are ways in order to avoid, I don't know. That is just the area I'm confused about. Thank you very much.
Okay. Oh, thank you, sir. Well, sometimes in this kind of situation, is very important to know whether the person is hypertensive before, or he has any medical issue, medical challenge before. I mean, which kind of medical condition that he's suffering from before the drugs was given. Also, if it has been that he reacted to the medication, yes, people can have kidney injury, acute kidney injury. People can develop kidney problem as a result of medication. Some drugs, like I mentioned, in like aminoglycosides, some drugs, there are some drugs that can affect the kidney when taken. Because most drugs you use, they're supposed to, if like this gentamicin and this aminoglycoside like gentamicin and the other class and other examples of that aminoglycoside, especially that gentamicin, they are, before you give certain drugs, you make sure that the kidney function test is done, that the person has a normal, you do serum electrolyte, urea and creatinine, and then assess the kidney function first. Then having assessed the kidney function, you should be able to hydrate, give fluid, let the person be on infusion before you can use some aminoglycoside, some drugs like I mentioned. Then apart from that, there are other drugs too that can affect other heavy drugs, drugs that can affect that can reduce the enzymes in the body, affect the enzymes like cytochrome P450. There's enzyme, that liver enzyme, that can affect the metabolism of drugs. And when they affect the drug metabolism, then there is accumulation of that drug in the body. So the drug will not be able to be excreted. Remember that the kidney excretes toxic substances. So if it is not excreted, it means that that kidney is now having issue. The drug will accumulate in the body, in the circulation, and affect the kidney. So that's why they need to do all this. They do assess the kidney function, make sure that the electrolytes are normal, the potassium, the sodium, and all the urea and creatinine. They are very important. They are the major determinant for kidney disease, urea and creatinine. So once you have assessed the kidney function, you should be able to, okay, see, let me give this kidney this medication. Again, it is also good to have checked after that person have taken that medication. If the person has checked the kidney function test, you will now know how the electrolytes are deranged, whether the urea and creatinine had been affected by that. You will now know, okay, this is the drug, the culprit that may have caused this. It's good to identify the particular drug that the person takes which may have caused the condition. But it is clearly, we all know that drugs has adverse, what is called adverse drug reaction. Adverse drug reaction, that is side effects. Drugs have side effects. So for that question of whether a drug can affect the kidney or not, some drugs can affect the kidney, some drugs can impact, cause kidney issue. Some drugs can affect the kidney. Other drugs that can affect the kidney are the these drugs, the chemotherapy, some chemotherapy drugs that they use in management of cancer, treatment of cancer. Some chemotherapies like some of the drugs, cyto, yeah, you know, cytotoxic drugs that can affect the kidney. They use in the management of different cancer tumors in the body. It can affect the kidney too. So those are the things. So it's good to assess the kidney function first, before and after. If the person is sick, serum electrolyte should have been done. No, look at the kidney so that you now know, okay, the electrolyte level are normal. I took this drug and developed start after which I developed kidney problem. So it means that that drug that the person took is the culprit, what's causing the condition at that moment. But if it's not, if the person has the values in the electrolytes and creatinine level, if they are deranged before taking that medication, that is why it's good to do that test before the medication in a sick individual. So if they have done it, and it's not normal, then it means that it's not due to the drug, it means that the person had a pre-existing disease. That is, he has a disease before taking the medication, that the kidney injury has been there existing, now waiting for something to come up. Thank you very much.
This explanation, I'm really grateful for that. There's just another question. What can be done for someone that has donated one of his to our kidneys? What health benefits? What is it health benefits now? What are the precautions such a person is to take? Because he was given the condition that he wouldn't be as healthy as when he has two kidneys. So please, can you explain that to us now?
Okay. On that note, someone that has donated his or her kidney should also live his normal or her normal life. Should not be worried. If the person lives his or her normal life, like I mentioned earlier, avoiding all the risk factors, things that can trigger kidney challenge, kidney problem, things that can make somebody become hypertensive or develop diabetes, knowing fully well that he is left with only one kidney. If he keeps to all the avoidables, if he avoids all the risk factors, avoids all this, he will still live his normal life. The only thing to note is that when one kidney has been donated, it makes the other kidney to function as if the person has two kidneys. So sometimes you may have the kidney that is functioning, the one that is left may be now be doing the work of the way it was when he was having two kidneys. So you will still be functioning well. There's no problem. You will still be functioning well. So long as he has avoided all the risks, he has tried his best or her best to try to avoid the risk factors, avoid being smoking, avoid excessive alcohol intake, avoid unhealthy lifestyle, you know, being involved in regular or routine physical activity like exercise to improve vascularization of his kidneys and all in internal organs, and to be healthy. He doesn't have anything to worry much. If he does these things, the body will take care of itself. So that's it.
Okay, thank you so much, Dr. Collins, for that wonderful time. We are so grateful for taking out your time to facilitate this session. We would like to release you because we know you have patients to attend right now. We also want to appreciate everybody for taking out their time to attend and listen to this wonderful presentation. You can watch the replay of this presentation on our YouTube channel at Desol Medical Center on YouTube. Just search for Desol Medical Center on YouTube. On Facebook, we are Desol Health Group. So you can see us on Facebook at Desol Health Group. And on LinkedIn, you can see us at Desol Med. So you can reach out to us there for any information you have, or you can contact any of the numbers on the screen for more information. Thank you all for being part of this session. God bless you. Till another time, you will hear from us at Desol Medical Center.
Recording stopped.
Oh, thank you.